New research from Johns Hopkins demonstrates that vitamin D not only helps treat and prevent osteoporosis, but heart disease as well. A study of 1,010 men showed that adequate levels of vitamin D cuts your risk for heart disease. Clinical trials are happening right now to try to figure out whether getting your daily requirement or more of vitamin D may actually prevent cardiovascular disease. According to healthmonitor.com, the strength of your bones has a lot to do with how much calcium they contain. Vitamin D is also a key player because the body can't absorb calcium without it. About 12 million people over age 50 have osteoporosis. Another 40 million have low bone mass. The specialists at the Center for Medical Imaging explain how a DEXA scan helps your doctor assess your bone health.
DEXA stands for Dual Energy X-ray Absorptiometry. It's a mouthful, so that's why it's always referred to as DEXA scan. Basically, it's a bone density test. The system that we use uses X-rays, typically over the hips and the spine, to measure how dense or what the makeup of that bone is, how porous it is, if you will. Patients who have low bone density, who have lost bone mass, are at a higher risk for fracture if they were to have a fall. As women get older, it's important for them to understand what their bone density is, because if they have a low bone density and they're at an increased risk for fracture, it's something that they want to discuss with their physician to see if there's any actions that they can take in order to improve their bone density. Whether that be a change in their diet, adding weight-bearing exercise to their daily routine, or if medication is involved. The DEXA scan is used to determine exactly what their bone density is so that the physician knows how to guide the patient. There are certain risk factors that determine one's higher risk for having lower bone density. Simply by being female, that is a risk factor, mainly because of changes that go on in women's bodies that don't go on in men's bodies. Hormonal changes that are associated with menopause, changes that can occur during pregnancy. For instance, a pregnant female, if she doesn't have the proper nutrition in her diet to keep her calcium levels up, the developing baby will actually leach away or steal some of the calcium away from the mother during pregnancy. So that increases the woman's risk for having a lower bone density later on. It's very important for women when they're younger to make sure that they're doing everything they can to build up their bone density. So that means keeping calcium in their diet, whether it's through milk products, some vegetables like broccoli, those are excellent sources of calcium.
And for more information on CMI's numerous imaging procedures and board-certified radiologists, please click the Osteoporosis Screening Story link on our homepage, yourhometownhealth.com.